Well, let's go to Niall Dickson just first before we get to the Health Secretary. Neil, I do apologise if we do have to interrupt you when we do get to speak to the Health Secretary. I'm sure you'll understand. But do you believe that the advice the government has been putting out in the last couple of weeks has been contradictory, or do you think people are just being willfully stupid and ignorant, ignoring it?
I don't think either of those are true. Well, I think there are people who are ignoring the advice in the sense of getting together and not social distancing and not taking seriously some of the other public health advice. I think my general view is that the government is following the scientific advice. I think it's a fast-moving situation. That means that what was right last week may not be right now, so it will be changing. And I think getting the communications right is going to be absolutely vital as we keep going. And I think, to be fair, people are trying to learn a bit at the centre about how to do this, so one has to give some lax around that. But I think there are obvious concerns on the front line. You've heard them around equipment, and certainly we've been hearing some pretty anguished stories from the front line over the last few days. So there's still some concern, in spite of the fact that the centre is saying, OK, we know we didn't have exactly the right arrangements to get stuff out quickly enough. We have now done it. We are doing it now. We're working round the clock. Make sure those trucks are on the ground delivering what's needed. But obviously we'll have to see over the next couple of days. We would certainly expect to see a much quieter reaction from on the ground. There's certainly been some loss of confidence among clinicians around this, and we do have to restore that quite quickly, because they're worried about testing and how much testing there is of staff, and they're worried about equipment. I would say those are the two big things. There are some other issues, but these are the two big things we have to get right. That said, government has done well in some other areas, and we're pleased with the legislation which is coming forward today.
Yeah, the emergency legislation, indeed. Well, if you could stay on the line, Niall Dickson, NHS Confederation Chair, thank you very much.